Autism, a short history and primer. The history of autism. In 1925, Granya Suhariva was a Soviet child psychologist and the first scientist to write about autism, doing so 20 years before Hans Asperger. She first described it as eccentric psychopathy before labeling it autistic psychopathy. It is likely that if her findings were more well known, the disparity in men and women with autism diagnosis would be severely diminished. Hans Asperger and Action T4. In 1943, Hans Asperger published Die Autistischen Psychopathen im Kindesalter, the autistic psychopathy of childhood. This paper focused only on boys, and he described the children as being little teachers on their favorite subject. In contrast, Sukariva's focus group contained a nearly equal amount of boys and girls. Asperger, though his role and knowledge is debatable, sent level 2 and 3 autists to be euthanized by Action T4. Autism as a diagnosis. Donald Triplett, age 89, is known for being the first person to be diagnosed with autism in 1938 by Leo Kanner. The first woman diagnosed is not known. The first use of autism as a term was in 1908, but did not describe what we today would know as autism. It was until the 1980s that autism would start commonly being diagnosed, and prior to that, autistic patients were often described as schizophrenic, retarded, or psychopaths. Lovaas and applied behavior analysis. Ole Ivar Lovaas was a psychologist and inventor of gay conversion therapy and applied behavior analysis in 1962. Both are largely seen as abusive by their respective communities, but only conversion therapies thus far banned. Aversives used in ABA treatment, such as shock therapy, have actually killed autists, and many autists have died to despair due to ABA treatment. What is thought to cause autistic symptoms? Autism is thought to be caused by an overgrowth of certain brain regions during childhood, and is characterized by rapid and odd synaptic connection. It is primarily a genetic condition, and often autistic people have parents of higher intelligence than the general population. However, there is also some evidence of an environmental factor. Asperger's and other defunct diagnoses. Asperger's is now known as ASD Level 1. Childhood disintegrative disorder, level 3. Pervasive developmental disorder not otherwise specified, level 2 to 3. It is important to speak to a doctor, as the above criterion is not medically evaluated and may be incorrect. ASD level 1, also known as Asperger's, are higher functioning autism. In our neurotypical-oriented society, ASD level 1 can result in communication issues and have a disabling effect on the individual. In a holistic society, people with ASD require some support in order to function, but often are able to live independently. As with other forms of autism, people with ASD level 1 can be sensory sensitive and have special interests. ASD level 2. People with ASD level 2 will have repetitive behaviors and major communication issues. Repetitive behaviors and their special interests can make it hard for them to study or perform certain tasks. They may, like the other forms of autism, also be sensitive to environmental conditions. As an autistic society would be better suited to helping such individuals, as negative environmental factors can be reduced in ways that neurotypicals may not realize. Level 3 autists will have major communication issues and need large amounts of support. They may not be capable of verbalizing in decipherable ways. They may have extreme repetitive behaviors and extreme interest in a single topic. Like the other forms of autism, they may have sensory sensitivities. It is a hope that Level 1 and Level 2 autists, through shared experiences, can better interpret and understand the needs of Level 3 and be a better aid than neurotypicals. Thank you for watching, and have a great day.